All right, back to that breaking news. President Trump announcing just a few moments ago his administration has, quote, the answer to autism.
Effective immediately, the FDA will be notifying physicians that the use of well, let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol during pregnancy, can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good.
Joining us now is Dr. Dallas Reed, an OBGYN and chief of genetics at Tufts Medical Center. Thanks for joining us, doctor.
Thank you for having me.
All right, Dr. Reed, we've heard time and again from doctors and medical societies there's no link between autism and acetaminophen use during pregnancy, but now the White House says there is. So who do women believe?
I'd say that those agencies and the doctors are probably still saying the same thing as we were saying before this announcement. And I think one of the things that I heard in that conference was that patients should talk to their doctors. They should talk to their doctors about their concerns, and we will always have a conversation about all the options available to people depending on what their ailment may be.
So the president also said there's no risk to not taking acetaminophen. If doctors say it's safe to use it, though, for pain or fever during pregnancy, what's the risk of more women trying to tough it out? Is there truly no risk to toughing out pain?
So pain can cause stress and high blood pressures for some patients. One of the things we also know acetaminophen is used for is fever. Some of the other medicines that can be used outside of pregnancy, like NSAIDs, like ibuprofen, for example, we know are definitely not safe in pregnancy. And so acetaminophen is still a very safe option for patients who are having pain that isn't solved by other means and who are having high fevers, because that can be very dangerous in pregnancy.
All right, so we also want to ask you about this drug, leucovorin, that the president says could potentially reduce the symptoms of autism. Is that what the data shows?
There are some preliminary studies that look at leucovorin in a subset of patients with autism who have folate deficiencies. It's a smaller group of people. And so there's some preliminary studies that are promising. There definitely needs to be more studies and more information out there to see if it's applicable to all patients with autism or just a subset. But of course, we are open to seeing what the latest research will show in regards to treatments and prevention of autism.
And I want to ask you one more question, Dr. Reed, while we have you before you go. So the president talked about the numbers, the diagnosis numbers of autism, saying decades ago it was, 1 in 10,000 or even greater. Now it's 1 in 31. These were the president's numbers that he put out there. Do you think that we just know much more about this disorder and it's better diagnosed, or is there an increase in the number of people who have it, or is that impossible to measure?
I think autism is a very complex condition, and when we say the word autism, we're not even really talking about one diagnosis. There are many differences between individuals with autism. Certainly, I think the awareness of autism and the diagnostic tools have improved over time, and that may contribute to some of the increase. And there may be other factors. We know it's a multifactorial condition. Genetics and non-genetic factors play a part. So I think it's definitely worth looking at what those factors may be. I just don't think acetaminophen is one of them based on the literature that's out there and the data that I've reviewed and the societies that sort of govern our practice have also reviewed.
All right, Dr. Reed, thank you so much for your insight today.
Thank you.
Thank you so much.